Hi everyone, I'm Dr. Sylvia, a general practitioner and health educator with AskAwayHealth. Welcome back to part 2 of my videos talking about your cervix. Last time we looked at the cervix, where it's located and what it does. In this video we will be talking about the health problems that can affect the cervix. Before that though, let's do the nice stuff. Like this video, subscribe to the channel if you haven't done so already, and let's begin. Starting us off at number 1 is cervical cancer. This is cancer that affects the cervix. Infection with the human papillomavirus HPV is the most common cause associated with cervical cancer. So among the most important things you can do to reduce your risks are attending the cervical screen and getting the cervical cancer vaccine. Important factors that can also contribute to the risk of developing cervical cancer are having multiple sexual partners, sex at an early age, sexually transmitted infections such as chlamydia, gonorrhea, syphilis, HIV, and very importantly, smoking. Number 2, cervical warts. Cervical warts are a type of genital warts. Genital warts are painless growths or lumps that happen around the genital area or anus that can be small but grow to different sizes. In the genitals, they can also cause itching, make you feel uncomfortable, and if you don't treat them, they can grow. If you have genital warts, you might also experience bleeding with or after sex. But they can also grow in the cervix and even grow to such an extent that they block the cervical canal. And if you remember from our first video on the cervix is the channel leading from the vagina into the rest of the womb. So in this case, they can prevent a normal vaginal delivery in which you have to deliver your baby via a cesarean section. Warts are also caused by a type of the human papillomavirus known as the low-risk HPV. This is not the same strain of the virus that causes cervical cancer, which is known as high-risk HPV. So just because you have genital warts doesn't mean that you're going to develop cervical cancer. And warts can be treated with creams or procedures that include cutting or burning off the warts from your skin. Number 3, cervical polyps. Another condition that affects the cervix is the development of a cervical polyp. A polyp is a benign growth that can happen anywhere in the body, but this is located in the cervix. And as you can see in this image, this growth often appears to be sticking out of the cervix. It often has no symptoms, but it can be one of the causes of vaginal bleeding after or during sex or heavy menstrual periods. Treatment usually by cutting off the polyp or treating it with laser to burn it off. 4th is a cervical ectropion. You may also hear this condition being described as a cervical erosion. It happens when cells from inside the cervix start to grow outside the cervix. The best way I can explain this is we have different types of cells all over the body, and cells of the same part of the body may have different types on the inside to what is on the outside. This is because the cells do different things. So if the cells that usually stay on the back start to travel into the front, this is similar to what happens in a cervical erosion. You'll often not realize that you have a cervical erosion, but it can cause vaginal bleeding during or after sex. It's a common problem and it's harmless, and your doctor recognizes it when we look at the cervix through a vaginal examination using a speculum. In terms of what causes it, we think it happens from hormonal changes. So we often see it in younger people, those who are going through puberty, if you're pregnant, or while using the combined contraceptive pill or combined contraceptive method. Number 5, cervical dysplasia. A dysplasia means an abnormal change to the cells of an organ which may precede the development of cancer. One of the abnormal changes we see with the cervical smear is dysplasia. Remember, in a cervical smear, we're collecting cells from inside the cervix. The specialist examines the cells under the microscope and can identify dysplasia from the appearance of the cells. It doesn't have any symptoms, but once it's identified on the smear result, it must be treated. So it's important to attend your cervical smear appointment because remember, dysplasia doesn't have any symptoms. Meanwhile, please check out my video here where I talk about some reasons that you might get an error on your cervical smear result. The next condition that could affect your cervix is cervicitis from sexually transmitted infection. Cervicitis means an irritation or inflammation of the cervix caused by germs. These germs lead to sexually transmitted infections and they travel through the vagina after sex. For example, chlamydia, trichomoniasis, gonorrhea, syphilis, herpes, and so on. The symptoms of cervicitis can include pus-filled vaginal discharge that can be yellow, cloudy, grey, bloody and smelly. You may also have pelvic pain, bleeding in between your periods or bleeding after sex, and problems passing urine. The germs that cause cervicitis can travel through the cervix and up into the rest of the womb and into the fallopian tubes if you do not treat this condition quickly. So it can lead to PID, which is pelvic inflammatory disease. PID is a serious condition. It can lead to infertility. It can also lead to a severe infection within the rest of the abdomen known as peritonitis, and that can kill. Please check out my video here on acute causes of pelvic pain, where I also talk about pelvic inflammatory disease. Next on our list of conditions is a cervical prolapse. A prolapse is when an organ sags or slips from its natural position. Many organs in the body can prolapse, commonly the bladder, the womb or the rectum. One of the key contributors to prolapse is the development of a weakness of the pelvic floor, the muscle which holds up the organs in their natural place. The pelvic floor can be weakened by pregnancy and delivery, if you're overweight, menopause and other problems. I have videos on the pelvic floor and conditions related to pelvic floor dysfunction on my channel, as well as how you can strengthen your pelvic floor. Make sure you check them out. Now, when the womb prolapses, often it is the first part of the womb that sags down into the vagina, and in the most severe cases it pushes past and can actually be seen outside the vagina. It is the first part of the womb that does this, and this is the part that we see outside the vagina, which is the cervix, and this is why it is called the cervical prolapse. Next is the cervical fibroid. Fibroids are benign growths of the womb and can be located anywhere in any part of the womb, including the cervix. And fibroids can show different symptoms depending on their size and whereabouts they are located in the womb. For example, a large fibroid in the cervix may be able to block the birth canal, meaning that the only way to deliver the baby is via cesarean section. So please check out my videos in my fibroids playlist to learn more about this condition, and I answer so many different questions about fibroids treatment. Number 9, let's talk about a closed cervix and how you can tell if your cervix is closed. In the first video, we saw that the cervix is the doorway or the gate or the channel between the vagina and the rest of the womb. So it allows or prevents entry and exit of different things either into or out of the womb. This happens through the opening in the cervix called the os. In the closed cervix, the os is closed permanently. We also call this cervical stenosis because the os may be narrowed rather than being completely closed off. It is possible to have this condition from birth. Other ways a closed cervix can happen are following a complication of womb surgery or after scars that form from infections like PID. It could also develop after conditions like endometriosis or cervical cancer. Symptoms of a closed cervix can include irregular and painful or absent periods. And of course, a closed cervix can result in infertility because the sperm are unable to travel through the os and up into the rest of the reproductive tract. You can tell if your cervix is closed with an internal examination by your GP or your gynecologist to look at the os. We can usually tell if the os is open or not by looking at it, or when we're trying to take a sample or even do a cervical smear. If it seems unusually narrow or abnormal in any other way, we may try to pass a probe, and the fact that the probe is unable to go through indicates that the cervix is closed. And finally, for this video, let's look at an incompetent cervix, and that's a term that we use to describe a cervix that cannot stay closed throughout the term of a pregnancy. We also refer to it as cervical insufficiency, and it can lead to premature birth or miscarriage because the cervix opens too early in the pregnancy. And sadly, we cannot know who has this condition before a premature birth or loss of pregnancy happens. We do know that in some cases, having treatments for an abnormal smear or following a D&C can put you at risk of an incompetent cervix. Some studies suggest that Black women have a higher risk of developing a cervical insufficiency, but it's not clear why. So there are no signs of cervical incompetence in early pregnancy. Symptoms might include mild pelvic pain or spotting from around 14 to 20 weeks of pregnancy. Now, if your doctor determines that you had an incompetent cervix in a previous pregnancy, they will provide preventive treatment in the next one to avoid the risk of it happening again. This can include having frequent pelvic scans for monitoring, and using a cervical stitch to keep the cervix closed. So these are some of the conditions that can affect your cervix. But I also get this question, doctor, why does my cervix hurt? And there can be various reasons for this, including some of these conditions that we've already mentioned. But another reason is during sexual intercourse. Don't forget that from part 1 of our video on the cervix, we learned that the position of the cervix can change at different times of your menstrual cycle. If you're at that time of the month when your cervix is lying low, then pain may happen during intercourse. So thanks for sticking to the end of the video. I know it's been a long one, but I hope it helps somebody out there. Please send any questions you have on this subject to our email service, and give this video a like, and don't forget to subscribe to the channel. Make sure that you've clicked the notification bell so that you know when our new videos go live every week. Next time I'll be talking about the big tummy and how you can differentiate between the big tummy caused by diastasis recti or having fibroid, or simply being overweight. I hope you'll join me for that one, and while you're waiting, check out these two here, and I'll see you again soon.